And now I'd like to introduce you to the Community Health Director for the American Heart Association, Victor Arredondo. Victor, all yours.
No, Victor.
On successful employee health. So I hope to that today we'll talk in the short time that we have. I'll give you an overview of health in the workplace, why it's important mainly. We're going to talk about some strategies for a successful workplace health program and how the American Heart Association can help your employees. And of course, we'll open it at the end and have 5 to 10 minutes for questions. So, in order to understand employee health and in order to understand the employees' perceptions on their health, the American Heart Association contracted with Nielsen with a representative sample, nationwide sample, in different parts. In total, about 2,004 adults. And we asked them several questions related to employee health. Now, we really wanted to understand the employees' perceptions because usually we start our efforts on top, bottom-down approach, and we tell the employees what they need, and we do whatever we think, the leadership of the employers, what we think they need. And most of the times they have a different perspective on what they need themselves. So it was important for us to understand. And throughout this report, you'll see the phrase among those encouraged. And that just refers to employees who indicate that senior management encourages participation in wellness programs. So, and you have to remember, employers vary in size, in number of employees, and resources. So the principles that I'll be discussing today really can be applied throughout any number of employees or the different structures of the employee wellness. So the first thing that we started to ask is just their perception of health, what they thought their health was like. And if you notice on this slide, the overall health, 74% of those who were surveyed responded and reported they were in very good or good health. However, 42% reported that they had been diagnosed a chronic condition. And if you see on your right, the chronic conditions are high cholesterol, high blood pressure, arthritis, diabetes, obesity. So what we're learning, what we're seeing, the first thing is employees' perceptions show us that they believe that they're in good health. However, the reality of their health might be different from what they believe, what their perceptions are. Usually they're worse. And on another national survey, not just for employees but in the general public, we found the same type of association or relationship, that people perceive their health to be better than what it really is. And so we see a great opportunity to involve these employees in their own health. And if you notice, the last part is if they wanted to change, they wanted to improve, and most of the employees reported that they wanted to lose weight or that they wanted to be more physically active. And as we kept on asking more questions, we saw the importance of their perceptions in all this. And so now I'm going to talk about the reality of the situation. We know for a fact that 70% of the health is determined by behavior and the environment. So that means the genes all play an important role in all this. But the environment, which in this case the employee's environment is the workplace, has a great influence in employee health. When we think about it, employees spend about half of their waking hours at work. It makes sense that employers invest that they are engaged in employee health when it has such a impactful change and influence in their own health. And if you start thinking about it now, the savings to cost ratio is in reduced absenteeism and healthcare costs is about $3 to $1. And that's very important. You know, these research studies were published quite a bit ago, but we have more confirming evidence and more peer-reviewed evidence that this ratio keeps increasing, or that it confirms this $1 to $3.50. So what this means is that we can save in healthcare costs if we invest in employee health. And it might be easier for a larger company, or it might be easier for a smaller company, even though there's diverse structures and organizations. The bottom line is investing in employee health pays off. As we kept on asking these employees, and we kept on learning more about their health, and by the way, I don't believe I mentioned this. The reason we wanted to learn more about the employees' health, another reason, is because the American Heart Association got together with the largest the CEOs of the largest employers nationwide, and all the CEOs, which we call the CEO Roundtable, decided to learn all this. So these results were presented during those meetings and are actually now being presented for this. But if you notice, 81% of those that were encouraged by their senior staff report that it's extremely or very important for their employees to offer workplace wellness programs. Most of the employees that are being talked to on Influences Health want and require and need employee wellness programs. And even the worst case scenario, 52% overall, half of the employees said or reported that it was extremely important or very important that employers to offer workplace wellness programs. Should tell any employer the importance of investing in their employee wellness. If you notice in the graph below, employees themselves are recognizing the benefits of an employee wellness program. Most of them recognize the reduction in employees' healthcare costs, which the bottom line is very important because that the employees are recognizing themselves. The cost is significant. And so why shouldn't we invest in the employees' health? And I think most of us recognize that. I think most of us know that the health of our employees improves retention, improves employee morale, and obviously improves the health of their own employees. It's sometimes a matter of how we're going to do this. And so after studying these results, the CEO Roundtable, in addition and supported with other scientists and other researchers, got together and defined and published these 7 pillars of workplace health. Now again, I want to remind you that even though these pillars, it's easy to think why it would work in a big corporation with thousands of employees. It's also tailored for the small businesses with few employees, fewer than 25 even. And these principles should apply to any structure of the employer or the workplace. So the first is leadership. It's very important. I will talk more about leadership, but the way leadership in the organization shows the support for health. The second one is policy and environment. The local organization policies, the rules, or the way the workplace is structured that promotes or doesn't promote health. The programs themselves, the incentives, sometimes financial incentives, sometimes other kinds of incentives, but the actual programs. Then the communications between employer and employee, the way we communicate as employers regarding health to our employees. Partnerships, the way we involve other partnerships in this employee wellness is very important too. We don't have to offer all. Usually in the community there's many other many other partnerships that we as employers can make in behalf of our employees, so that our employees benefit from the local resources that ultimately will also influence their health. Reporting outcomes. It is crucial to report outcomes. We want to measure, we want to really see where our employees' health is at so that we can know where we can improve. And ultimately, engagement. How our employees, it's of no use to have this great workplace wellness program when employees are not participating. So today, since we don't have the time to touch in detail about all these, I'm going to touch on leadership, programs, and engagement. And so let's start with leadership. When we surveyed these employees, remember, 55% of them believe that it's extremely important or very important or important to see a CEO setting the good example. So replace the CEO term with leadership. If whatever size organization you have, top leadership should give the example, should be involved, should show their employees that they themselves are engaged in the worksite wellness program, or that they are engaged in health for their employees. We see more information on this topic, and if you notice the 17% on the top left, very few employees were aware that their CEO or their leadership team was involved in health. So sometimes we have to do a better job, not sometimes, we just have to do a better job communicating as leadership that we are invested in health. And it doesn't have to be in a big PR movement. It can easily be by sending a newsletter with a video or a picture of the leadership participating in an employee wellness program, initiative, or in health in general. But employees need to recognize that their leadership is invested and is engaged in any health-related activity that the employer is promoting. In fact, if you notice on the right, 26% believe that their employer cares a great deal or a lot about their employee health. This is when these numbers are quite low, and we should have employees recognizing that leadership does, because the R is involved, because it does boost the morale, as I mentioned, but it is a positive way to do a top-to-bottom approach to health. So let's talk about programs. Let me pause for a second here. When we talk about programs, they come in all shapes and sizes. We don't usually have. There are evidence-based practices that enhance employee wellness programs, and for employers that have the ability to contract this wellness initiatives out, or they have insurance program that delivers already employee wellness, it's great. But the small businesses that sometimes it's harder for us to contract out these services, we could also have our own program there. And our principles apply the same, and even though our resources might not be the same, still we can have an employee wellness program, or at the very least promote healthy behaviors while in the workplace. So we have some examples, but we know that when employees participate in workplace health programs, it is a win-win, because employee satisfaction increases. 69% report that those programs have strong impact on job satisfaction. People like coming to a place where they're being valued. And employers showing that the employee's health is of value to them shows them precisely that. Recruitment, 49% say that employer who offers wellness programs is extremely or very attractive. And as important, retention is 63% cite those programs as the reason for staying with their current employer. So we see that it is very important to have a health workplace program. So how do we do that? We know that only 6.9% of all workers in the U.S. offer a comprehensive health. And what I mean comprehensive means it involves initiatives related to nutrition. It involves initiatives related to smoking cessation, to physical activity. It involves incentives. It's a comprehensive approach to health. And most of the times we start our programs and we think that a newsletter to our employees is a program, where in reality, the opportunities that we give employees to practice healthy nutrition or physical activity will do more than the newsletter. Now, those newsletters are important because, again, we're trying to communicate to our employees that we care about health. Those are important, but they are not the entire program. They have to be based on evidence. They have to be engaging. They have to be health-focused, of course. And we have to try to engage in a more comprehensive way than just during National Walking Day, for example. And by the way, there are different health observances during the year that usually gauge or help engage the employees, such as National Healthy Eating Day, National Walking Day, Heart Month, of course, other months, Nutrition Month, that are very important and that usually help the employees be engaged in this. And we'll touch a little bit about that. But the bottom line is that our programs have to be evidence-based. And what is evidence-based? Unfortunately, we don't have the time to get into this too much, but anything that provides the opportunity, for example, providing healthier snacks to our employees, providing time for them to take a break and practice physical activity, setting up walking paths inside or outside the office so that the employees can take a walk during their breaks, promoting good, simple, easy to understand education in common areas, and of course helping or facilitating the support among employees so that they can all unite or at least share their concerns and help each other with their concerns. So normally we don't have the data, as we see 90% of the employers do not have sufficient data to calculate or measure the wellness programs. And hopefully we'll help you with that later on. But it is also important to have the data where we can say our employees need help here. So we're going to focus our efforts here. Of course, as I mentioned, engagement in these employee wellness programs is crucial. So when we talk about how to engage our employees, this is what we learned from them. Those encouraged are nearly twice as likely to report improved health. If we communicate to them, if senior leadership is participating in the wellness, if senior leadership is involved in recruiting and promoting this and inviting the employees to participate, they're twice as likely to report improved health. And those who receive encouragement have experienced at least one positive workplace outcome. So again, making the activities coming from the top leadership, communicating effectively, will help employee engagement. Let me show you something else that we learned from them. The importance of retention is extremely important, as we saw. But as we're trying to engage their employees, it's very important to engage them in the type of activities that they seem attractive to them and they see positive towards their own health. So when you're planning your worksite wellness programs, involve employees. It doesn't have to be a long time commitment, but as long as they're involved either with a survey, with a short little interview that you can have with them, but involving the employee in their own health will help them become engaged in the program themselves. Facilitating their involvement in this program also helps. For example, providing incentives for participating in the physical activity. And incentives can vary in many different ways. They don't always have to be financial. They can be in time. They can be in a partnership with a gym, for example, where you can receive gift certificates to that gym. There's many ways to provide incentives, but if we facilitate that involvement, employees are more likely to improve and to participate. So, lastly, I want to finish because I want to have some time for questions and answers. The American Heart Association locally has free resources for any work site and any size and any structure. And we call them right now the Workplace Health Solutions. We have a framework where we first assess the culture and the health status. And again, this is all free, no cost to the employers, where we have a tool where the employer can measure where they stand in a comprehensive workplace program. After seeing where they stand and after using the tools that AHA provides, we can consult with AHA staff here locally and talk about ways where they can improve. The AHA then supports the efforts of this business to implement the change. And ultimately, if they've made changes, we have formal recognition that can go to the employer on a national or local level. We again, because reporting is important, we again review the data and we start all over again. The American Heart Association has a lot of resources for employees, again, free of cost. And the only reason we do this is not to sell a product, but because we know that a culture of health is important. And an employer has a unique position to influence that culture, where we can start thinking of our employees and we can start showing them their value, where we have outcomes-driven programs, when we show leader engagement, and we have champions within the organization that motivate them to participate. We know that if we invest in employee health, ultimately the entire community has benefits from that. So I would like to open it up for questions and answers, and knowing that you can visit at any time the playbook, which is the 7 principles, 7 pillars of health, by going to heart.org/workplace health, or you can contact me directly. So now we'll open it for questions and answers.
And just to recap, if you do have any questions, we encourage you to use the chat box on the bottom right corner of your screen, or you can also press *7 to unmute your line. So I'm not seeing any questions at this time, which means you did an amazing job of informing us on the topic of health in the workplace. I wanted to thank you all for tuning in, and thank you to Victor for joining us today. We really appreciate your time. And we also encourage you to join us for our next Chamber U, which is going to be next week Friday, on marijuana and your business. Thank you again for everyone for joining us, and we'll see you next week.